Today I'll be doing a very quick Q&A on diastasis recti. This is really common in women who are pregnant or postpartum, and they may notice that they have maybe an abdominal bulge or some doming. Maybe they've heard of coning in their abdomen. So I just wanted to create this really quick Q&A just to answer any common questions that a lot of my patients have about diastasis recti. So we'll start with, what is diastasis recti? So diastasis recti is a condition that is really common in pregnant and postpartum women, but it can also occur in men as well, or anyone who has not even been pregnant before. And it's a condition in which your abdominal muscles start to separate. Now, these abdominal muscles are your rectus abdominis muscles, known as your six-pack muscles. And these muscles begin to separate during the pregnancy because of the growing uterus and the growing baby in the abdomen. This is a very common condition in all pregnant women. So pretty much this happens in all prenatal individuals because of just the changes that are happening in the body during this season. The reason why this happens is because the connective tissue or the abdominal muscles, they're simply just stretching out to accommodate the baby. So when there is a stretching of the tissue, it is common to see little bulges or like a dome in the middle of the belly, just because the tissue is a lot thinner because it's stretched out. So you're seeing that internal abdominal pressure being shown up in your tissues. So how does it happen? I kind of touched on a little bit earlier, but our abdominal wall and our muscles are made of collagen. Now, collagen is made of like fibrous tissue. So it's kind of like a rubber band. So collagen has ability to kind of stretch and lengthen, so it's pliable. So what can happen again is during pregnancy, the abdominal tissue stretches out, the tissue becomes very pliable, and everything becomes very lengthened. And as a result, the abdominal muscles begin to separate, and we see that separation. And you may notice either a gap in the middle of your abdominal muscles located along the line of your umbilicus or your belly button. So how do I know if I have a DRA? So usually a physical therapist will perform an examination to assess if you have this. This assessment can be done during your pregnancy, and it also can be done during postpartum. So what I typically have patients do is I just have them lay on their back and I have them bend their knees. I place 2 fingers at their umbilicus, above and below. So I assess along different areas along the umbilicus, and I just have them lift up their head. What I'm assessing for is the amount of gap between those 2 muscles, and I'm also assessing for how deep my fingers can go in, as well as once I insert my fingers, if the tissue that I'm feeling is either soft and squishy or is it kind of more firm and dense. So I'm assessing the quality of the tissue. So you know if you have a diastasis recti, official diagnosis is if you have a 2-finger gap between those 2 abdominal muscles. But honestly, if you have a 1-finger gap, I still kind of consider that a diastasis recti because of that abdominal split. So you may also notice some doming or bulging. So if you look at this photo, you can see that this is your abdominal wall. This is your abdominal muscle, so left and right. And this is the linea alba. This is the tissue between those 2 ab muscles that stretches out to accommodate the growing uterus. So what you may see is when you do like a sit-up test, or you lift up your head, you may see a little dome or a little bulge. This doming occurs at the linea alba and can be a sign that you have a diastasis recti. You may also notice bulging. So you may notice that because the tissue is a lot more lengthened and stretched out, you may notice that there's just an expansion or a little bulge of your entire abdominal wall, as well as at the linea alba. So doming occurs at the linea alba, bulging occurs at the entire abdominal wall. And this is a great photo by Munira Hodani. She's a great physical therapist who specializes in diastasis recti. So I credit her photos to using this on my presentation. You can have doming, you can have bulging, you can have both. So the first example is here, the person here, when they do a sit-up test, is they just have some bulging of the abdomen. And you can have various amounts of bulging. You can have a lot, or you can have just a little bit. You can have a mix of doming and bulging. So you have a bulge and a little bit of dome. So there's different variations of how diastasis recti can present. So what are common myths of diastasis recti? So one common one that people will be like is don't do any sit-ups or crunches. Now, this is a myth because a lot of my patients that I see with diastasis recti, I'll actually give them some sit-ups and crunch type activities to help strengthen their core. Now, I might not begin with these types of exercises, but these type of spinal flexion exercises or curl type exercises strengthen your rectus abdominis, and that actually helps decrease the gap between your two ab muscles. So this is why I like to really incorporate sit-up type activities. The only time I might not consider doing these exercises is if you have a lot of bulging and doming and you're not able to manage that abdominal pressure very well, then we might kind of delay when we might start those type of activities. But it doesn't mean that just because you have a diastasis, you're going to avoid all sit-ups and crunches. Another common myth I hear is avoid planks. Now, planks are actually a great exercise to do because when you're on your hands and knees, you have to contract your abdominals and lift against gravity. So it's actually a really hard exercise and a wonderful exercise to train your core. If you are having a lot of doming or bulging in that position, again, then I might delay when we might do that exercise. But again, a very good exercise to do. And it's just really dependent on each individual. So I highly recommend seeing a pelvic floor physical therapist because they can give you more guidance on whether planks are appropriate for you and whether it would be a good challenge for you based on where you're at. And then another one is no lifting. So that is, yeah, I'm not really a fan of that. Like, don't lift if you have diastasis recti because honestly, we're lifting all the time, whether we're lifting or bending down to get our shoes, lifting groceries, lifting our babies. Lifting is actually just a very common day-to-day activity. Now, the only reason lifting might be, don't do it is because you might see some of that bulging, that doming present in your abdomen. Now, a physical therapist can really guide you on maybe different ways to move or how to engage your core in those exercises so that you can still lift and do those type of activities. So what can be done to heal a diastasis recti? So one of the biggest things that can be done is to start physical therapy. Now, when you're healing a diastasis recti, the whole purpose is you're going to do exercises and core strengthening exercises to help thicken up that fascia, to thicken up the abdominal wall so it's not as thin and stretched out. So loading your tissues, your abdominal wall with core exercises, with adjusting your posture and your alignment, strengthening your glutes, and maybe optimizing how you're standing when you're carrying the baby. All that can help heal your diastasis recti so that you can prevent things like surgery. Other things that can be helpful are nutrition. So making sure that you're consuming protein, bone broth is a really good option just to help stimulate collagen production in your body, to help thicken up and heal that connective tissue. Other things to consider is your rib cage mobility. So typically during pregnancy, as the baby is growing, the rib cage can be a little bit more stiff. So working on mobilizing your rib cage and just improving your spinal mobility can be a great way to optimize the function of your diaphragm and your core muscles. So there can be a lot to heal diastasis recti. I highly recommend seeing a pelvic floor physical therapist as early as your pregnancy stages, just to start you getting to connect with your core, and as even early as 3 weeks postpartum. You don't have to wait 6 weeks after your OB visit. You can really start connecting with your core really early on in postpartum. I always say the earlier you start, the better, because that way you learn how to activate things correctly and that you don't develop any compensatory strategies or any strategies that are inefficient for your body, or just strategies in which you're not using the correct muscles. So it's always great to start early if you have a diastasis recti. So will a belly band help my diastasis recti? Not really. So A belly band is not going to decrease your gap. It's not going to strengthen your core. It's simply just an external support device to support your belly if you're feeling a lot of strain and tension in your belly. So let's say that you have a diastasis, but you have a lot of a thinned out and stretched out tissue. A belly band can help because it can support that tissue so that there isn't increased load or stretch on that tissue, possibly making or putting more strain on that diastasis. So it can help, kind of support the diastasis, but it's not going to fix it. How long does it take to correct a diastasis recti? So I would say give yourself at least 12 to 18 months because it takes time to build your core strength. It takes time for your fascia and your abdominal wall muscles and all that connective tissue to rebuild itself, to thicken up, to build more collagen, basically to kind of like shrink back. So it takes time for that to happen. So if you are, if you've gone through physical therapy and it's 3 months and you're noticing very minimal difference, keep going. It takes time to build strength, and making sure that your physical therapist is not only targeting your core, but your whole body, adjusting your posture, your alignment, optimizing your whole spinal mobility, strengthening your core, your pelvic floor, your back, your glutes, just strengthening your whole system is really going to help strengthen your abdominal wall area and decrease your diastasis recti. Now, if you're concerned about just addressing the gap, I just want you to know that it's more than just narrowing the gap. It's about improving your function, improving your activation strategies, using the correct muscles, just moving efficiently. So a lot of my patients notice significant improvements in their diastasis. And although it may not completely go back to like no finger gap, a lot of them make significant improvements that they're able to get back to exercise. They're able to get back to weightlifting or CrossFit or even running and not have any symptoms. So looking beyond the gap is something that I really encourage my patients to think about, not focusing so much on how many fingers is my diastasis or how deep is it. Those are important objective measures, but it's important to think more functionally and can I get back to the activities that I want to without any pain, without any symptoms, and just feeling like I'm moving well. So what are signs of improvement of diastasis? So like I mentioned before, improving your function, getting back to exercise. Other signs of improvement is if that gap starts to narrow. So you can see here that the gap is starting to narrow. That's another sign of improvement that can happen after several weeks or months of strengthening your core and optimizing your alignment. You can see here too that possibly in the beginning when I'm doing that assessment, I might be going pretty deep in your abdomen, meaning that tissue is very pliable. But as the tissue starts to thicken up and strengthen, when I'm pushing my fingers down, I might notice that that tissue is starting to feel thicker and that my fingers aren't sinking in as low. And same thing, like I said before, possibly when I'm sinking my fingers down, it feels soft and squishy. So it means that tissue is very stretched out and very thin. But as you strengthen your core, again, the thickness of that linea alba, that connective tissue is thickening up. So I'm starting to feel more of a dense tissue when I sink my fingers in. So again, all of these are signs of diastasis recti improvement. When should I consider surgery? So when would I consider surgery? So I would consider surgery after you've tried conservative treatment for at least 12 to 18 months. So diastasis recti, that tissue responds well to exercise. Tissue responds well to load, to forces, to movement. So I wouldn't even consider surgery unless you tried your conservative management first. Can a diastasis recti be fixed and addressed after many years? So definitely, yes, because this is a musculoskeletal problem. It's a connective tissue problem in which the tissue is stretched out, it's thinned out. Now, like I said before, tissue can be molded. Tissue can respond to load, to forces, to stresses placed on it. So exercise and movement can help thicken up your abdominal wall. It can help decrease the gap. It can help decrease the thinness of the tissue. So if you're 10 months postpartum and still having a diastasis recti, I would highly recommend seeing a pelvic floor physical therapist. It's not too late. I even see women 20, 30, 40 years down the line with diastasis recti, and we're still able to make improvements. So I highly recommend going around the conservative management of physical therapy and not, thinking straight to surgery. It's always movement is key. Movement is medicine, and that should be your go-to treatment if you're thinking about addressing this. So I hope you enjoyed that really quick Q&A about diastasis recti. If you have more questions, feel free to email me or message me on my Instagram or just drop a comment below, and I'd be happy to answer your questions.